everybody. It's some time since I came to this, but it's a place where I would like to come always. I'm very happy that you want to learn more about what's happening in Kerala. Kerala is one of the states in India, no, the only states today, where there is left government. And we in Kerala try to live up to the expectations of the progressive people all over the world, keep the flag flying, and we are very happy that in these corona times, everybody is forced to recognize what progressive movements can do. I'm not for a moment claiming that whatever we have achieved in combating corona is something the credit of those who are in power today alone. No. We are just carrying forward a legacy of decades of struggle, decades of movement, policy actions. Yes, Kerala is pointing out to what is possible today. Even within the present system, it's possible to have a better world. We don't need to have majority of the people illiterate, unhealthy, landless. We can ensure everybody have a decent life with dignity. And that is being proved once again in these pandemic times. I have a long list of questions which I just received now. I'll just follow the same order as the questions have given to me. And let me start. I'll start with Gopika Lishmi. Taking social health to a larger context, how has the developments in other sectors, including the progress in literacy and education, social security schemes, including welfare pensions, better wages contributed to strengthening of the public health? It's a very, very interesting question. Now, there is always a tendency to treat healthcare in isolation. No. It's a terrain where multi-sectoral, with a lot of multi-sectoral linkages, and this has to be kept in mind whenever we are talking about the health of a society. For example, in the case of Kerala, I would say education had been the prime mover in terms that it created awareness. It played an important role in creating a demand for healthcare, but not just education alone. The nutritional programs in Kerala, the land reforms in Kerala, provision of good drinking water, and everything you have mentioned, social security schemes, welfare, better wages, and so on, all have contributed to better public health outcomes. So health, good health is not just doctor plus medicine plus hospital. No. It means all this. So in fact, therefore, when we look at social indicators, the health indicators considered to be the best indicators of social development, because it in one sense encompasses the achievement on all these related sectors. And therefore, I consider this a very interesting way of entering into the health issues in Kerala. Kulvinder Singh, for us, how Kerala addressed the problems of most marginalized sections of our societies such as destitutes, Adivasis and transgenders during the pandemic. Well, let me confess, I don't want to say that everything is fine and perfect in Kerala. There are certain outliers, certain sections of society who have kept who are behind the mainstream. That includes Adivasis, there are destitute sections in Kerala, and so on. I would say to an extent even fisher folk and so on. Because Kerala model of development has been demand-led. People organize, make demand upon on the state, and the state is forced to respond to the demand. And therefore, in this process, what happens is those sections who are not able to, for various reasons, not able to organize themselves, make the demand, they can get left out. Now, history of Kerala is not just self-interest. For example, land reforms and so on. Every section of society has joined in the struggle. Therefore, there is a lot of mutual cooperation. But at the same time, we have to understand that certain sections who, for historical reasons, failed the mobilization and organizational movement forward, tended to get left out. And now it is in times of pandemic that the discrimination against them becomes very, very open. Therefore, the Chief Minister, in fact, has been very, very insistent that in the pandemic we have to pay special attention to these marginalized sections. For example, one marginalized section would be the migrant workers, and our local governments are instructed to inspect all the camps. If any camp is found to be unhygienic and not livable, the local government have to provide them with a new camp in the school or some public space, ensure there is food for them, medicine for them, and so on. And now the destitutes, there are a lot of, not a lot, the beggar problem, etc., is much lower in Kerala than outside, but still there are a number of people who live in the streets still. So everywhere, the local governments have picked them up and started camps. So now you don't find any street sleepers. They're all provided place to sleep with modicum facilities in schools and other Kalyana Mandapams and so on, and provided all the food and medical care. And also the tribals. One problem with the tribals in Kerala is that they form a very, very small percentage of our population, just around 1%. And the peculiar historical context in which they have been incorporated into the main society has tended to marginalize them very much. But now, definitely now, we provide double the share of their population in the development schemes, funds, and special care is taken for them. For example, community kitchens are there throughout the tribal belt. See, I represent one constituency, Alleppey. There are hardly any tribals. Total number of tribals in my constituency is 126, let me put that, families. But they are totally marginalized. They traditionally woodcutters, okay. That's the traditional job they were doing. And their marginalization can be seen, surprisingly, when I did a study of each of these family, that you find in this relatively much progressive Alleppey, about, say, 12 of them didn't have ration card, 12 families. Um, about 17, 18 didn't have say, labor cards for NREG work. Another equal number didn't have health cards. See, this is the index of marginalization, a pointer, the marginalization. They are so marginalized within the mainstream society itself. So we have a scheme named after P.K. Kalan, who was the bloc president in Wayanad, an artist but tribal. He passed away about a few years back. We have a scheme in his name to honor him, which you can plan, make individual plan for each family. No restrictions. What that family requires, you make a plan, a micro plan for the family, and implement it. So we have made micro plan for about 112 people. Rest of the families don't need it. And its transformation, I wish some of you will come and make a study how this small group of people, community has been transformed in a matter of 1.5 years. And now this pandemic came, we have started a WhatsApp group for them, the children. We started for the children, but everybody has joined in. And now this WhatsApp group has been extended to the rest of the district. And we are having many activities on the WhatsApp. We have looked into which are the families will need food support. Ensure free food is provided at their doorsteps. See about 3 dozen women, they have been given factory employment. In fact, they became the agents of change in the community. They're working in a factory for about a few months. Really transformed them. But now they became jobless. So we ensure certain support is given to them. You see, this is at the level that this individual family level, the care is taken. I don't say it's happening every place, but I tell you, these marginalized sections have been a very important concern for us during the pandemic time. Resigya asked me, we have heard about community kitchens in the state through LSGs. Local self-government institutions seems to have played a crucial role in state's response to pandemic. Going forward, how can LSGs be leveraged even further to address evolving challenges related to frontline response, livelihood, economy, etc., caused by COVID? They are very good here. I was been, for the last 25 years, very deeply involved in democratic decentralization. I left my academic career to work full-time in this campaign for democratic decentralization in Kerala. We had great dreams about how societal changes would come about through local government, empowering local governments. But you know, the case of Kerala, we alternate in power. By the time the democratic decentralization process reaches completion, the entire commercial prices collapsed, and the left government couldn't survive that collapse, and many of our dreams were smashed. So I used to feel slightly put off. No, we haven't achieved everything that we wanted. But in the last few years, there have been crisis after crisis. We had first the Nipah outbreak and Oki cyclone, then came 2018 floods, then came 2019 floods, and now we have this COVID. Is then suddenly everybody realized that something new has come in Kerala, the local governments. They became the fulcrum of local action, mitigation, or and also providing shelter and support those who are affected. Um, in fact, many agencies which came to Kerala used to wonder what's happening. I was in one camp. One of the colleges, SN College in Cherthalai, had been converted into a camp, and some agency people had come in the Onam time, festival time, big festival going on in the camp here. You won't think it is a refugee relief camp. So they were asking, which is this NGO who is running this camp? In fact, I didn't fully realize what is the import of that question. Then I realized, yeah, most people think only NGO can do it. So I showed the lady at the end of the Maidan talking to people, playing with children. She was the Panchayat person. I said, oh, that's our NGO. We have created administrative structure at grassroots level where this big walls, Chinese walls, which separate civil society from state, are no more there. There is a synergy which is possible to tap through local governments, and that has come in good stead in pandemic time. What has happened? One, they start the community kitchen. Okay, government gives a call. Within 4 days, community kitchens spring up in every panchayat in Kerala. Not one community kitchen, many panchayats serve 10, 12 community kitchens serving in every ward. Anybody who is hungry, who cannot cook for some reason, do not have food in the house, can come and take the food. Now, these are not some, say, rice gruel which is being served. Good food. Yeah. Now, do you know what is the number of people involved in these kitchens? Say, total number is nearly 1,400. Now, just the cooks. Most of the material, the vegetables, everything is collected from people who be volunteers who would go and collect and bring them. Then importantly, these 4 lakh meals are served, not served in the hall. They are delivered at the doorstep, most of it. Otherwise, you have to come and collect your food and go home. But it is enough that you phone up and I want the food, and then the food is delivered to the home. Then each kitchen would have some 20 volunteers to do that. See, this is what I said, the synergy, okay? Now they want fund for that, they have the fund, they have the resources. Now they monitor the sick people, quarantine people, ensure they're there, and so on. And now the challenges in the future, the livelihood, economy, and so on. For example, we are going to open up our agriculture first. Now local governments have started a campaign. Everyone in the lockdown period should start cultivating vegetables in their house, rich or poor. And many places are picking up. Kerala may become self-sufficient in vegetable demand. It's very much possible because everybody is taking to cultivate some vegetable or not. So I'm saying just one example of this. So the local governments will continue to play a very important role in protecting livelihood and the exit strategy of the state. I may come back to it later. Now, Alina Siji asks, how did Kerala manage to address medical needs of heart patients, cancer patients, pregnant women, etc. in the middle of lockdown and heavy demand on the healthcare system due to coronavirus? What role did the investment in healthcare and local governance have to play in managing this? Okay, the healthcare system in Kerala, public health system in Kerala is a historical legacy, I told you. But, for some time, this legacy had been seeding. One achievement of the present left government is that they started a mission to invigorate the health system in Kerala. We did a number of things. One, some 4,000 crores of rupees into health infrastructure, including equipments. Now every taluk hospital has 20 dialysis machine. Every general hospital has a cardiac department, district hospital. Every medical college has an oncology department, and so on. Secondly, we created 5,775 new posts of doctors, nurses, and paramedics. Three, now palliative network have become universal. Hospital development committees are very active. And for example, in my place, I have got in my constituency around 1,500 health volunteers who have collected the health data for the entire population. We have a database. We have screened and found those who have diabetics, who have hypertension, and so on. And then they are being provided medicine. Okay, this is an extreme case of community participation. But this is happening all over Kerala in a mini scale in the COVID times. The primary healthcare center, it has a very effective spread link of the ASHA workers, Sanganabadi workers, and so on. And we have also Kudumbashree self-help group, women neighborhood groups, which cover about 55% of the population, households in Kerala. And each of these group, women group, 2.5 lakh groups in Kerala, have one person who is called health volunteer. So we use all these volunteers and scheme workers to reach the houses, deliver the medicine, and every primary health center now also have telemedicine. You can phone, consult the doctor. If necessary, doctor will come. In this process, I want to tell you, the palliative groups play a very, very, very important role. I mean, I speak from my experience. We have, in my constituency, palliative groups covering every locality. Not just covering means providing them palliative care. For the last 2 years, we have been providing palliative patients who are, say, bedridden and who are destitute. Around 600 of them, food in the house, free, daily. Even with that, you have got a hotel in my constituency where there are no tariff wall, no cash counter, no bills, nothing. If you want, you're hungry, you can go there and take the food, and good food. And there is always a non-veg, okay, if you are there in the afternoon. And then, if you have money, you pay what you feel. If you don't have money, you don't pay. Now, you may think that this place is going to go bankrupt. No, no. Last year, total expenditure, because it's not priced, I cannot say what is the cost of but the cost of cooking the food and so on, everything, material, is nearly 1 crore rupee. And we got 85 lakh for contribution, voluntary contribution. So, see, this is the way we are taking care. Now, these are best example, best practices, but these times of crisis is when these best practices get scaled up. For example, community kitchen, the call came on the basis of experience of this hotel I took. So we were saying, see, for 2 years, here is a hotel running like this, where you can, if you don't have money, doesn't matter, go and eat. And a lot of people, middle class people, come to take food there. Some of them as a sign of solidarity, but food is good enough to pay for it. It's not a gruel center. Now, it is from this we scaled up to the people's hotels in the budget. where in every panchayat a hotel of this kind will have to start, where food will be served for a fair price of 2 rupees 20, and those who don't have money free also. Then the pandemic came, so we decided, well, let's have community kitchens. These community kitchens, after the crisis, would become the budget hotels run by Kudumbashree. So you see, how is all this possible? This is possible. It's not all directed from the center. There's very energetic local governments. There are elected representatives who intervene, get these things done. Of course, there's planning from at the top. It's a multi-layer, multi-level planning process. It's not just planning at the local level alone. There is a chief minister who's leading, who has got a large number of committees at state level, who monitor and who draw out a strategy which is planned and implemented at the local level. Arjun Premkumar, how is Kerala handling educational loan issue in the context of COVID-19? If colleges open late, exams are postponed, what happens to loans? What about scholarship? Yeah, we have a fairly liberal scholarship, and scholarships are being paid whether there is school or college. It is paid on time. There has been some delay in the last year, but all arrears, everything is being paid now. Now, what will happen to education loan if you are in arrears? Well, we have a scheme to help people who have defaulted and facing problems with the banks. The government makes a deal with the bank. Some money will have to be paid by the beneficiary, but government bears the main burden, and the bank also will have to take a little bit of haircut. So we have dealt with educational loans up to 2016. That's all loans which are in arrears, non-paying NPAs and so on. This has been a great help, and this is in fact the only state in India where a government has such a program to help students who have graduated but do not get job and therefore cannot pay back. Arjun Prem Kumar, okay, this is now. Om Bikash Kumar Das. What were the major initiatives taken by Kerala government to control COVID-19 mortality rate to 0.5 in the state? That's the normal international mortality rate would be something like 5+, and India about 3, but in Kerala is 0.4, and just 2 deaths. How? Because we have already prepared isolation wards and so on. And morale of the health workers are fantastic. Each one of them thinks as a matter of pride that deaths shall not snatch away one of their patients. You should see people walking out of the isolation wards. All the nurses and doctors come, all clap, and like heroes these people walk out of the ward. Biggest celebration was when 93 and 88-year-old couple, grandparents, who were infected by the children who returned from Italy, and and they had a whole lot of health complications, cardiac problems and so on. In fact, there were many moments, days thought that things would take an unfortunate turn, but they walked out of the hospital. That was a day of big celebration. Now this morale is important here because he is a government which cares, and society which cares, which also supports the health workers. One of these days in late night, I was standing in one of the community kitchens in my constituency in Alleppey, and then from the midnight, late night workers from the hospital, they were returning in the bus. Then one of the volunteers went and stopped them, and I saw they were all given kits of vegetables, all the nurses. It's not that it's great what vegetable they receive, but it's a token of appreciation, society's appreciation for the work that is being done. What a contrast with health workers in some of the hospitals in Mumbai, the kind of accommodation they receive, the treatment received, overworked without proper protective equipments. So this kind of morale comes from a kind of support that you give to health workers. And they are the heroes. They consider it as part of the great pride of the department that nobody dies. And I don't think anybody is going to in this coming days. The recovery rate is so fast. Today I have a tweet, look at the curves. Already our recovery, number of recovered has far passed the active cases. And at this rate, the number of active cases would be can be counted in fingertips by the end of the month. Now, Asha, we know that the implement of GST is indirectly affected overall revenue collection of the states, and simultaneously central government is going on with the several measures like lagging the state shares and reducing GST compensation fund, and also less central share in the COVID special package for Kerala, etc. So in a federal system like ours, how can we overcome this situation? What are the possible channels to overcome this? Is it through the legal measures that you have mentioned earlier, or in the federal channels? One, well, there is discrimination against Kerala. That's a battle Kerala will have to fight. But states are neglected, the states as a whole, you see. Look, today, this month of April, no state in India has any income. They get a share of the central transfers, which will be 1/5 of the normal revenue of any government. So how do you run the government? So you find, irrespective of political affiliation, every finance minister in India is demanding that revenue in the fiscal deficit ceiling be raised, that compensation, GST compensation is paid, and so on. And while I would say this is the more important battle, we try to build a broadest front as possible to protect the federal structure in India. And so we are going to have a webinar on 27th, 28th, where almost all the many of the important leading academics and ex-bureaucrats, and hopefully at least 7, 8 finance ministers will be participating on this theme. So this is the initiative taken by Kerala. Of course, Kerala discrimination is there. We'll try to have pressures to relieve that. But I think it's just not Kerala alone. The states are being discriminated and neglected. That's a challenge to the fiscal federalism in India. Asika, there have been opinions that there could be a second possible wave in Kerala around June or July. How can we be prepared, and how can we prepare our economy for such a situation? Frankly, I think there will be. I don't think you have to wait for June, even before that. See, once the lockdown is over, Malayalis, Kerala has a large expatriate Malayalis spread all over India and also abroad. Some 20 lakh in Gulf region alone. So, large number of them would want to come back. Primarily, many would have lost their jobs. So, they would like to come back. And Kerala will have to welcome them, take care of them. And we may get into another wave, the third wave. So, that's the real situation. But we can't keep our economy locked up indefinitely. So, it's a very complicated situation. I think broadly this is what we are planning to do. One, we are prepared for all those people who are coming back, they would be quarantined 3 weeks. So we are prepared for that. 2.5 lakh accommodation has been already prepared and ready. Those who can afford, they can stay in hotel, quarantine hotels, where they will have to pay. Others would have, state will be paying. Now, second, there are vulnerable population. Kerala has about 13% of the population above the age of 60. Then, with a high life expectancy, there also comes all sorts of complications. The incidence of lifestyle diseases are very high in Kerala, and therefore about 15% of the population would have to stay indoors. They have to stay in the house, even in the house, in the room. That means a big challenge. Their health care, perhaps providing food to them, monitoring their health, but that has to be done. These are vulnerable sections. We don't want to expose them. Okay. Rest of the healthy people, they'll have to go out and work, but keeping the social distance. No, our slogan is keeping the physical distance. We don't socially distance with each other. That's the slogan. Physical distancing and social uniting. That's the slogan of Kerala. So, physical distancing, keeping the norms, which means a lot of rearrangements in the workplace and so on. It means changing many of our habits. I think we have stopped spitting. We are champion spitters, a lot of beetle chewing in the past. That tradition continues. But I think COVID, we have stopped. We have imposed a big fine if they spit. And then there are, of course, washing hands, sanitizer, wearing the mask, and so on. So, and we have an these are broadly the way we are going to meet this challenge. We'll have to keep on improvising. We can't predict everything. But nevertheless, we are thinking of doing big data analytic. We have now with us, we've been able to access huge data, about 2.5 crores of Kerala population information from WHO. Their say, tuberculosis surveys they have been conducting over time. So some of them would have been no more, but still, it's a big data. And integrating other information with that, we should be able to plan meticulously different scenarios or what should be done. There are a lot of startups and other people, academics, who are engaged in this work. So we are preparing for it. Abhishek Padar, Kerala being in independent tourism, now that the economy is hit, how does he plan to stabilize it, considering tourism won't be generating much income till the end of the year, at least? Very right. So tourism will be the last sector which will be opening because tourists have to go to come. But we'll start preparing for the next season. And one important preparation is marketing. We are going to market Kerala. Kerala's brand has gone up internationally. And all these foreigners who were marooned in Kerala because of the travel restrictions are going back. And many of them have been quarantined, and many of them have been sick. And initially there was a lot of misgiving. Yeah? Their work country, their hospital, their quarantine. But many of them were giving glowing tribute to Kerala's health system. I know in my Alleppey, there was an American lady who was quarantined, of course, in a hotel. We had taken over that hotel. And when she finally found tested negative, she was free to go, and there was flight for her. But then she asked the collector, "Can I stay on in Kerala? I am safer here than in New York." Well, that's a goodwill. So we shall try to sell brand Resilient Kerala, a place where you will be safe. Therefore, we'll start marketing Kerala in earnest. Don't wait for the year end. Gautam Radhakrishnan, what impact do you foresee for emerging industries, more specifically small and medium IT technology firms, due to disruption brought by the crisis? How does the state plan to address it? Just today, I had a long video conferencing with small scale industry leaders. Now it's a very serious situation. And now, in the demonetization, a lot of small firms closed up, they never opened. Because there was no kind of planning to help them. Say, look at the small traders, their shops are shut. And now 3 weeks or 1 month, there will be nothing left of the area. If you have grocery shop owner, I don't think the food there would be edible, grains or pulses and so on. So they are all facing heavy losses. And I was very upset that Reserve Bank today had the second package. But how do you support these small enterprises? How do you restructure the loan? How do you provide them additional working capital? Well, we have started a discussion and dialogue, and next Tuesday the Industries Minister included, they will be taking a meeting, and we will try to see what can be done. But of course, Reserve Bank, India government will have to cooperate in this endeavor. Dinesh Mahapatra, can you elaborate on dangers of reverse migration? As lockdown ends, people will go back to the homes. Possibly won't come back to cities, just master months. What is the time horizon you are seeing for this to stabilize? It will take some time. There is both push and pull factors. I think Kerala wages are very high, and that will be pulling them back to Kerala or to the cities, and compared to what the wages in the villages. And there are push factors in the villages, and now post-pandemic period is now going to be very interesting time to stay in the village also. Big challenge is that how do you ensure a decent life to the migrant workers? You see? Now this COVID has brought very dramatically in front of the nation the plight of the migrant workers. And I hope this will be a turning point in our policy approach to migrant workers. Even in Kerala, I would say Kerala, we want to put the standards much higher. My standard would be Uralingal Contract Labour Society. I have a book on the leftward on this cooperative. Majority workers are migrant workers. Now this cooperative has given membership to migrant workers so they are not discriminated. They get equal rights as the Malayali workers. And when the COVID came, some wanted to go back to Calcutta. They are given bus and all comforts to reach back to Calcutta. Those who are not still remaining, They are in the camps, they are given all care, and I think that should be our standard. Fatima Sultana, with COVID-19 situation, many NRI Malayalis have lost their jobs and they're coming back. What are you going to do? It's a big problem. Yeah, it's a very big problem. How to integrate them back into Kerala? We knew it is coming, okay. And therefore, my budget in 2016, the first subtitle was a second stimulus package in the context of return migration. Well, to that extent, we are prepared. Yeah? I don't want to go into details because it's getting time. We are closing at 8 o'clock. But no, return migration is a big problem. And it's going to affect Kerala economy. Maybe demand for nurses and so on in Europe is going to increase because of this, and there would be a possibility of migration into Europe, maybe. But this is an issue that we are working on. Usher, we know the implementation of GST, etc., etc. What is the question? So in a federal system like us, how can we overcome this situation? What are the possible channels to overcome this? Is it through legal measures? Yes, we may have to go to legal measures, but you know, the situation in India has changed. It's no more that all states are being controlled by the ruling party at the center. Majority of the states are by other parties, and therefore the composition of GST Council is so changed to that extent, and therefore there is much more interaction and debate that is possible. Well, I think this issue of center-state financial relations has become very important theme of discussion, and Kerala is trying its level best to have it, to bring it back into the center state. We already have been taking initiative for 3 seminars, 2 in Delhi and 1 in Vijayawada and 1 in Puducherry, 4 seminars. We'll be organizing more seminars, hopefully 1 in Mumbai also. Now the role of left politics, I'll have to summarize it in 5 minutes' time. Annuvarti Saxena, what is the contribution of the left movement in Kerala to its building stronger infrastructure public health sector? You should read an article by Professor John Mentor comparing Thanjavur PHC with PHC in Palakkad, lessons and non-lessons of Kerala model, Kerala health set. She is saying if there is something lacking, then there is a public response. The contribution of the left has been primarily creating this demand, and all progressive movements included this demand. And whenever left came to power, 1957 is then the health system, which was much stronger than southern Kerala, began to extend towards the northern Kerala. And as I told you about the contribution of the present left government, Lakshmi, in the light of experience of Cuba, China, Vietnam during the crisis, how do you see international response to COVID among different political spectrum? Well, our aspirations is to become the Cuba of Asia. Of course, within India, but still as a model of healthcare to which people can look for inspiration, and perhaps we also reach out to other states and other places. Sampath, do you think the pandemic and its anticipated adverse economic impacts on demands systemic restructuring of a policy ecosystem? If so, what should be its nature? Now, it can go in many ways. Now, a crisis can lead to a strengthening of authoritarian regimes and people. That possibility is there. How can you rule it out? At the same time, this pandemic has exposed the hollowness of the present health system, not only in India, but also the richest of the countries. And it also has brought forth to policymakers and everybody the larger relation between nature and human species. Now the future is not going to be, is going to be determined, something which was said by Fidel Castro, not only by the social contradictions, but also contradiction between nature and man. And this present calamity shows the capitalist system cannot resolve these contradictions within itself. And look at the neoliberals. Everybody is becoming socialists or Keynesians. so, and it's for temporary period. So this crisis exposes them. Crisis also underlines the need for an alternative. And in little way that we can, we are saying, yes, another world is possible, another way is possible. With all the limitations, yes, that is our aspiration. Thank you very much. Thank you. Good night. I have got a TV program.